Hi, everyone. I am Jacqueline Hart. Each year, the Women's Refugee Commission honors courageous and brilliant activists such as yourselves. Dr. Susan Gana Okonkwo, Yasmin Kayali, and Karina Ambartsoumian-Clough. Congratulations to all of you. We're privileged to have you join us. Thank you. Karina, you work with stateless people in the United States. Can you say more about your organization and what you do?
Yeah, the organization I work with is called United Stateless. We're a national organization. We are led by stateless people. Our mission is to inspire and build community among those affected in the United States and advocate for our human rights. Our vision is, as an organization, is to serve as a clearinghouse of knowledge and expertise on statelessness, serve and support stateless people, and to ensure that everyone's human right to nationality is respected and upheld. I came to this line of work because I myself am stateless. I left my country of birth, which is the former Soviet Union, at 4 years old, and I am now 32 years old in the United States and still have no pathway to legal or any status. I'm even married to a US citizen. Learning that there's other people in my situation through the years all over the United States has been like incredibly empowering.
Thank you so much, Karina. I appreciate that. So, Susan, you are a gynecologist. Can you tell us a bit about the work that you do and also what brought you to your work?
As a gynecologist, I used to see patients individually. So, but that got me to thinking, is that enough for me to do? Why can't I go into the bigger picture to see if there are things I can do for women in general? I said, well, this is what I want to do. I want to go into where women cannot access care and provide care for them, where children cannot access care within 24 hours of their symptoms and provide care for them.
Thank you so much. Yasmin, could you tell us how you came to do this work?
So the organization that I co-founded in Lebanon back in 2011 is called Besme and Zaytoune, which is the smile and the olive. And we started after the influx of refugees into Lebanon. At the beginning, we all came from different walks of life, and we were just trying to respond to the huge humanitarian need and the gap that we felt existed with the INGOs. Were overwhelmed with the numbers. People were falling through the cracks, and there was a lack of dignity in the way people were being treated. And so we started with the basic food baskets, hygiene baskets, blankets, giving medical assistance, assuming that it was all going to end very soon and we were all going to be able to go back to Syria. Unfortunately, things began to escalate and unfold, and we saw that this was not going to be the case. So we registered the organization with the hope of doing something more strategic, and our vision was for a constructive society that lives with dignity. And I'm very proud to say that our first project that was funded by an international organization was a women's workshop. You have to understand that most of the refugee population is made up of women and children. Men comprise less than 25% of the population because most men are either fighting, missing, captive. So it has been quite a journey for the last 8 to 9 years.
In terms of doing empowerment programs with these women, can you say a bit more about what you do in this difficult context?
The biggest reason for dropouts out of our programs, and specifically out of our school program, is due to child labor or child marriage. Unfortunately, a lot of the families, in order to avoid tarnishing their reputation or having their daughter being hurt by the young men within the settlements or the camps, they marry her off, and therefore, she is now protected by her husband, and also they have one less mouth to feed. And today, by the way, with COVID, according to some of the studies being done, there's a 50% increase in the level of abuse in the home against the women and the children, because people are stuck indoors and they are very frustrated, and with the lack of income, all the anger is being taken out on the women and the children. And this is something we have really tried to work hard against.
I think there's this theme of really having a systems approach and a holistic approach and having a multi-pronged strategy to create sustained change. Karina, Can I ask you to talk about what kinds of strategies your organization uses on the issue of statelessness in the United States?
We realize that the biggest issue is that stateless voices don't have representation. We are seeing that, regardless of where you are as a stateless person, regardless of how vulnerable you are you completely undocumented, or do you have DACA, or are you under ICE supervision? Each one of those levels of statelessness or flavors needs representation. Our organization's 3 pillars is educating, advocating, and building a community. Many times, stateless experience in the United States is very solitary, it's very lonely. So building that place of healing, place of connection, camaraderie, and support is really crucial and important.
What role do you see for an organization like ours in this work and the struggle that you're part of?
Help us research more. Help us research at federal level, local level, even just basically in the state of New York. Help us research what are the patterns of stateless migration, where they're coming from, and what are their stories.
Susan, would you like to go next?
Women Refugee Commission has brought in a lot to the state, and we are really, really appreciative of that. They are also looking at training people on ethics and research with the Ministry of Health, which is something that is very, very good. Plus, we can now be able to do some research on our own to see how we can improve the health status of the state.
Can I say something, please?
Of course.
I wanted to speak for the role of advocacy and research. In the end, I can do as much relief and development as I can, but if we don't have the advocacy and we don't change the legislation, then nothing will be changed long term. In the end, anything that you want to sell, an idea or a project or whatever, you need to back it up with data. Same thing with the legislation, same thing even with the donors. You need to convince them. How am I going to convince them that this is valid and it's going to make long-term change? I need to back it up with data, and I need to advocate, because today the whole environment is donor-led. Without advocacy and without the research, we will not be able to really be responsive to the needs of the community. We have to have the right amount of data, and we have to have the right kind of people opening doors. And I think WRC is one of the drivers of this.
Thank you so much. Is there anything else that any of you want to make sure that you say?
Yes. My drive actually is to see women and children able to access healthcare. You're not alone. There's somebody out there that will help you, only if you can make your voice known. Be it night, be it day, be it that you're in an inaccessible area. Just make that voice and somebody will come running to help you.
Thank you, Susan. Yasmin?
Actually, I want to make a call to the general community and to tell them that count your blessings, especially at this time where we're in most countries in lockdown, when you have a roof over your head, when you have food to eat, and in case you do get ill, you can have access to medical care. And you know what? There's a lot of opportunities to give back. Giving back even a very small amount makes a very big difference to grassroots organizations like ours. Keep these people in your thoughts, in your prayers, and give back to them as we try to ease this immense difficulty that they have already been passing through, and now another layer has been added to it.
Thank you, Yasmin. Karina, any last words?
Awesome. My final words are: believe our stories. That's the first step of supporting us. Join us. If you or anyone else you know is stateless, you have a home, you have a community of people here.
Thank you. It's been a pleasure and an honor to meet the three of you. And I just want to thank you for your work, and to say that I personally and we at WRC are in solidarity with you and your work. So thank you.